Yeah, so it's an interesting one because chicken and the egg do they have this overarching sensitivity that the binocular vision is just part of, and then so they're sensitive to movement, they're sensitive to changes in visual space. There is some research looking at things like fluctuations in your accommodation system being different in those kind of circumstances. There appears to be some people who have binocular visual dysfunction who have this thing called pattern glare. And I think that's where the flicker and shopping centres and pattern surfaces can be uncomfortable. Again, you can have pattern glare without binocular dysfunction and vice versa, so they're not always tied together. Not everyone who has pattern glare has binocular visual dysfunction and vice versa. But people might be sensitive to these kinds of pattern surfaces, and text can be a trigger for that. And so that's another thing that we kind of are looking for, that if things aren't adding up, it sort of sounds like a binocular visual dysfunction, everything seems to be okay, then, we start to get a sense from those kind of, what do you like in shopping centres? Do you get a bit of motion sickness? Do you get a bit of car sickness? So you find flickering lights annoying, that might lead us to kind of go and, okay, well, maybe it's a pattern glare issue as part of this whole, headache, sore eye kind of cascade that we're sort of looking at.
And so, like, obviously we can't just avoid going to shopping centres. So are there any practical strategies that patients might use to sort of reduce these triggers if there are, certain environments that are problematic for them?
Yeah, look, some people end up finding, if we can manage the binocular dysfunction, and we think that's part of it, then obviously that's one of the things that we need to sort of deal with. So get examined and just see if there are things there. There are some people in those situations where they might find certain colour tints that we test them with make pattern glare less glare inducing, and so they might find light tints and those sorts of things. Again, we need to individually kind of work that out. In terms of cell strategies, often if you've got some issues around shopping centres and things like that, going at quieter times can be useful. Perhaps going to shopping centres where the lighting's a little bit more natural. Ones where the surfaces that are used aren't quite so patterned, they're a little bit more bland. I do wonder if there are things like, how stressed you are, making it better or worse. So just having a little bit of a listen of, if I'm feeling pretty peaky and stressed at the time, maybe this is not the time to be going to the shopping centre. So in terms of own avoidance sort of strategies, I would certainly look at, times when there's more natural light, times when there's less people, and that's going to vary obviously from wherever you live and wherever your local shopping centre is.
All right. Well, just as a final question, if someone's been watching this and they're living with persistent headaches, and they've talked to their GP, they've talked to their neurologist, they've ruled out all of those sort of more sinister potential reasons, but they still haven't found answers yet, what would you like them to know?
Yeah, you need to get a vision exam. I mean, that's probably the one workup that hasn't been done yet. So getting a thorough vision exam that includes sight, refraction, which is prescription, binocular visual function, your accommodation function, and obviously sort of eye health. So making sure you've got all of those sorts of things covered would be a great idea.